country to help detect early signs of heart disease.
Crouse Hospital in Syracuse, now the first in central New York to use AI to help determine if there's a potential problem. Heart disease is the #1 killer of adults in this country, with coronary artery disease affecting nearly half of all adults. Unchecked chest pain can lead to a heart attack and even death. But thanks to new artificial intelligence technology, doctors are able to spot the trouble early and prevent unnecessary testing. As we found out in this NBC3 exclusive, it's something that's already helping patients right here in central New York. Looking at this patient's heart scan, at first glance, doctors may not have a clear picture of what lies within the walls of his arteries.
Trying to get a layout of where the critical blockages potentially could be.
This man came in with chest pain, but there was no precise way for doctors to know if there was trouble brewing without a cardiac catheterization until now.
This is a close call. I would have called it significant and recommended the next step. But now we have the benefit of CDFFR.
Thanks to artificial intelligence, cardiologists like Dr. Avneet Singh can now use a non-invasive test to see if a blockage could spell future trouble.
This technology is amazing because it can do that without putting a catheter inside your heart.
Doctors at Crouse Hospital are the first in our region to tap into this new technology called CTFFR. The heart flow plaque analysis is a non-invasive way to evaluate blood flow through the vessels affected by coronary artery disease, using a scan to create a personalized 3D image of the heart, accurately measuring the amount of plaque buildup and detecting potential blockages.
You get this absolutely beneficial information just using technology.
Dr. Singh says prior to using this technology, patients could end up with an invasive procedure and one they never needed. But that's all changing thanks to AI.
I think it's a great tool to sift through data which would take a human a long time, and then you have data that's actionable, which helps you make a very informed decision.
Since Crouse started using this new technology, it's been used on 53 patients. Of those, doctors determined about 9 didn't need a heart catheterization and instead could be monitored and rely on medication.
You're avoiding unnecessary testing. And it's not just the risk of the procedure, it's the angst that goes with, oh, I have an abnormal stress test, and you're waiting for your heart catheterization. You get a normal cardiac CT, you walk away with the reassurance.
Well, as for the man who came in with chest pain, doctors found the blockages were not significant. They actually recommended holding off on the next step, avoiding an unnecessary procedure that just months ago that patient would have endured.
Now, did AI uncover a problem in any patients that prior to using this doctors just wouldn't have found?
Yeah, it actually happened in 3 cases that they found. 3 patients would not have gotten this invasive angiogram because their assessment at first glance didn't look so bad. But using that AI technology, it did pick up on significant heart disease in them, and that patient did end up getting a heart cath and eventually stenting.
Really, it could be life-saving.
Yeah. Well, the risk factors for heart disease include smoking, uncontrolled high blood pressure, age, genetics, diabetes, kidney disease, and not getting regular checkups with your doctor.
It's amazing stuff. Coming up on NBC.